Welcome back to Chiropractically Speaking. I'm Dr. Prat, your host, and today we're going to be talking about something that doesn't get talked about enough. And it is talking about the unsettled waters and navigating the unsettled waters of adverse reactions in chiropractic care. My goal is to make sure that we can navigate through this okay and understand what it means when you have an adverse reaction, what to do about it, how to manage it, and how to avoid it into the future. It is a common practice, unfortunately, that you may have some discomfort post your chiropractic session, but that's okay. I'm here to help you and understand why that might be, how to fix it, and all of the stuff in between. So I'm a chiropractor. Why would I tell you about adverse issues related to chiropractic care? Because I care. And I want you to know what the difference is between something good and something bad. I also want you to understand that it's not always a negative thing to have some discomfort after chiropractic sessions. Now, let's start at the beginning. Chiropractic care involves chiropractic manipulations, which often means that we're moving your joints past a particular range of motion. That can create a cascade of reactions to your muscles, joints, and nerves, and as such will respond with some soreness, stiffness, or discomfort of that nature. That's the most common adverse response that's been reported by patients. More complicated issues such as cervical spine strokes, as well as neurological complications are reported, but not as much as you think, or not as much as the media would have you believe. So we are going to get into those things as well. You need to know why these things happen, how often they happen, what the chiropractor can do about it, and how they can avoid it into the future. And we're going to unpack that very, very slowly as we go through this episode. So let's get really specific. When we're talking about the lower level of discomfort, stiffness, soreness, fatigue, these are going to be temporary. These are going to be very, very minimal, minor issues. But if you think about it, it's kind of counterintuitive. You might be coming in to see the chiropractor for stiffness, soreness, or fatigue. It all comes down to the neurology around a joint. The joint is going to respond to movement plus or minus. So imagine you were a couch potato and you decided to get up and run 5K after being inspired by Terry Fox. You would probably enjoy the first 5 minutes of it, and then you would come back home and be very, very sore. That's not a crazy situation to comprehend. The same thing exists when you go and see the chiropractor. We are going to be moving around your joints in ways that generally the joint doesn't move. So getting that movement to happen will instigate or inspire certain reactions to occur at the neurological level, and it will create that signal to your muscle to either tighten up or to open up. Either situation will cause some reaction. And that is normal. If you got adjusted and nothing changed, would you say that that adjustment was very effective? So these are the things that we want you to start to think about. There is a spectrum of issues that can be expected here. Now, as a patient, you're probably not very well versed on what chiropractic is and what to expect post a chiropractic session, especially here in India, where mostly people have not been to a chiropractor. This can be a challenging situation for many people, and fear, unfortunately, plays a big role here in exacerbating the symptom. Let's say you walked into a chiropractor's office with a 4 out of 10 pain, and then after the adjustment, you felt quite a bit better. Maybe it went down to 2 out of 10. But overnight, your body tightened up, and you woke up and you felt 10 out of 10 pain the next morning. What is the possibility of that happening, and why would that happen? Now, while yes, there could be some tightening of muscles and tissues, movement has happened, and there could be some lactic acid buildup in the muscles, all of the above, things that happen when your muscles are moving more than they normally do. But the other element of this is largely mental or psychological, which I'm not saying people are crazy or you're making it up. It's on you. That's not what I'm saying. I'm saying the brain can amplify the signal or make that signal of discomfort more based on how stressed you feel about that particular issue. I'm going to break it down with a scenario for you. There's two scenarios. You're just going to compare them one to the other. Scenario one, you're sitting in your basement, you're watching TV, you're watching a happy, funny movie with a great ending. You turn off the TV and you're sitting in darkness. You make your way to your bedroom, and on the way, you stubbed your toe on the coffee table. While that's uncomfortable, that's scenario one. Scenario two, same situation. You find yourself in the basement. You're watching a movie. It's melancholy. It's dramatic. And unfortunately, the hero at the end of the movie passes away. Everybody's unhappy. And the movie ends with a kind of bittersweet taste in your mouth. You turn off the TV. You're sitting in darkness. You sit there for a moment, let the gravity of the situation weigh in. And as you shuffle your way to the bedroom, you hit your toe against the coffee table. Same scenario, but two very different emotions, two very different outcomes. Now, the question that I have for you, and you can respond in the comments whether you agree or disagree. Which scenario do you think you're going to register more pain? It's exact same amount of movement. It's exact same amount of force that you stub your toe with. Everything else is exactly the same. The only difference is which movie you watched. So if you thought that you felt more discomfort in scenario two with the sad movie, I would agree with you. Why does this happen? When you're emotionally overloaded, we can consider this an emotional stress. We know that stress increases your overall inflammation in your body, which then magnifies pain. So if your body is feeling slightly sad or overwhelmed or stressed or upset about something, there's a really, really good possibility that you would be likely to rank your pain as higher than in a situation where you were super happy or enjoying something or whatever, I bought my toe, big deal. So in this particular way, you may experience exacerbations in your discomfort as more significant if you're stressed or confused about what might happen. I'm going to give you another example. When I treat patients with discs usually have 4 patterns of correction. Okay. The least common is the one where you see people improving step by step. Session number 1, 10%. Session number 2, 20%. And there's a steady 10% increase each session. So 10 sessions in and they're feeling 100%. That's what everybody wants. That's the ideal, but that generally doesn't happen. Another healing pattern that could occur is that somebody improves very quickly and then they taper off and plateau really early as well. Now, that's a patient situation. Now, it doesn't have to be where they've improved to 80%, 90%. It could be even 60 or 50%, but they see that rapid improvement, but then they peter off right away. That's a frustrating situation, but that does get better too. It just requires you to continue at it. Now, a third scenario exists where maybe you feel like you're getting worse. Like you started at a particular level and now your pain is getting worse. And you feel like, I don't know if this is the right option for me. I urge people in this scenario to hang in there because this is going to happen. Eventually, there's going to be a breakthrough and your healing is going to skyrocket out of this quagmire. It's not going to get much worse than that. You just have to stick it out. These people experience the fastest turnaround times and actually are the most happy patients because they expected a lot worse and they got a lot better. Now, the people who actually improve the most, the most common pattern that we see for healing with chiropractic care, especially related to discs, which is one of the most common things we see, is this kind of jagged pattern of up and down movement of this healing pattern, this sensation of feeling better. Now, you could probably go from like a 0 to a 4, back down to a 2, up to a 6, and the idea is not between sessions. It's not about how much you improve between sessions. It's more about how you improve from the start of your treatment plan to the end of your treatment plan. The idea is that overall you should see change, and that change should be sustainable. It shouldn't be a situation where, okay, I'm finished with treatment, now I'm going to get worse again. It shouldn't be like that. And that's the major goal of chiropractic care, is to make sure that your healing is sustainable. But going back to our analogy about feeling uncomfortable and how your brain plays a role with that, imagine you started with 10 out of 10 pain and we were able to bring it down to 4 out of 10. And you're good at 4 out of 10 for a little bit. And then there was something that happened and you spiked and you went up to 6 out of 10. I've had so many patients have this happen where that 6 out of 10 is now 10 out of 10. I'm back to square one. But we can very clearly say that 6 out of 10 is not 10 out of 10, which is what they reported initially. Why is that happening? Because of that emotional distress. They were feeling good. They felt like they were going to get better. They felt like 4 out of 10 was going to become 2 out of 10, 2 out of 10 was going to become 0 out of 10. They're going to be out of pain forever. Meanwhile, they've gone the opposite way. They've had a small regression. That's what I'd call it, a small regression of discomfort where it went from 4 out of 10 to 6 out of 10, which could be very temporary, but their brain makes it much worse than it is because it's disappointing to feel that way. And that's something that I really want to work around and get you to understand that adverse reactions in this way are not actually the end of the world, but it is just something that can be worked around and you should continue with. So how can we minimize the risk of adverse reactions? Well, it starts with your first session with your chiropractor. We always do a detailed history so we can understand the issues that had happened before, any issues that revolve around trauma, about injuries, about past medicals, any imaging that you might have. We try to review all of those things as thoroughly as we can to rule out this or that, and also so that you can understand that we're delving deeply into your history. We want to understand each and everything that would have happened to your spine and other parts of your body. If that is done, we are very clear about how to move forward with it. Now, the other issue about this is that some people try to kind of sift through and to, pick this or that from their health history without giving us the full idea. This is a bad idea, guys. Definitely be as forthcoming about your health history as you can in your first session. It gives us the best possible way to clear you for, further improvements in your healthcare. That communication element between the chiropractor and the patient should be the most prominent feature of any treatment plan or any interaction between patient and doctor. If we get this communication right, everything can be fixed, avoided, mitigated, improved upon, and sorted. There should be zero miscommunication regarding symptoms, regarding outcomes, and regarding the process. Qualified chiropractors are always going to make sure that you are educated on what we're going to do, how we're going to do it, what we're going to do next, and what you should feel moving forward. This is a hallmark of chiropractic care. The fear of going to a chiropractor stems from this idea of stroke. In other words, a cervical spine or neck manipulation causes somebody to have a dangerous or adverse event, including something called a dissection of a vertebral artery. Okay. This can lead to something called a stroke where blood unfortunately doesn't go to the intended route because of damage to an artery. In some cases, this can lead to paralysis. In some cases, this can lead to compromisation of different types of functions. And in some cases, ultimately death. The statistics that actually show and track right now are anywhere between 1 in 1 million to 1 in 10 million cases. Now, what does that mean in terms of percentage? That means 0.01% of all chiropractic manipulations would result in stroke. If I was to compare pair that with something like an over-the-counter medicine, which might be prescribed for something like neck pain, we're looking at a 0.3% chance of you overdosing or having some sort of adverse reaction to that medicine. You are 30% more likely to die from taking over-the-counter medicine, something that a kid could buy, than you are from having a chiropractic adjustment to your cervical spine. Now, let's go to the other end of the spectrum. Let's consider over-the-counter medication to be a very simple, easy recommendation from any doctor, to now a more serious situation involving a cervical spine surgery. Why some people think that having surgery for their cervical spine is better than chiropractic care is amazing to me, because we have found that 1,800 deaths in 1 million surgeries is the newest statistic that we can find, which means that if 1,800 people per million are dying from some complication of cervical spine surgery, that is more than 1,800 times more likely to happen than a chiropractic adjustment. Let that sink in for a second. 1,800 times more likely to result in death than a chiropractic adjustment. Who's fooling who? So let's talk about something called cultural authority. This is something that is very, very prevalent in discussions about chiropractic care around the world. And this goes back to our history of chiropractic discussion, which was in episode 1. If you want to go back and listen to that one, press the link up there. So early in chiropractic's existence, the American Medical Association wanted to squash chiropractic out of existence. There was a long trial, and finally the AMA was found to be violating the code of antitrust, which meant that they were trying to create an illegal monopoly on healthcare. And as such, chiropractic was granted this ability to be a separate and distinct profession. And a lot of that stigma still persists within medical circles. There's still a lot of, well, they're not doctors. What they're doing is not scientific. And there's a lot of that negativity that still exists. Now, it's getting better. I'm still getting lots of recommendations from orthopedic surgeons, neurologists, like lots of different people who were very, very anti-chiropractic for a very, very long time historically are now coming around to understanding, okay, well, there's a benefit here. There's something that can be done from a non-medical standpoint, and that's ultimately better for our patients. Chiropractors don't have this whole my patient, your patient. We don't want the credit. We don't need the credit. I don't care if somebody tells me that Dr. Pratap saved my life. I don't need that. I'm just happy to help. I get up every morning and I don't go to work. I just go and I help some people out. That's all I do. That's how I feel about it. So when it comes to this whole cultural authority, there's also issues from patients where they say, I don't know if I should continue with chiropractic care because I spoke to my doctor and they said it's not a good idea for me to do chiropractic care. Or they discontinue treatment after getting visibly good results because a family member, a misinformed or underinformed family member tells them that chiropractic care is not a good idea. Why? I'd love to see the evidence. Please bring it to me. I'd love to go through it with you. And if there's some way I can help you understand why chiropractic care would be beneficial for you in this particular situation, I'd be happy to go through it. The problem with it is our medical fraternity isn't always our best friends. I consider them my friends. I always consider them allies. I like referring to medical doctors whenever required. I think that medical imaging is necessary. I think blood tests and understanding underlying pathology is really important in getting to the bottom of why somebody feels a certain way or why certain pain isn't going away. I'm definitely with the fraternity of the meds all the time. I don't necessarily recommend meds. It's not in my scope of practice, but it's not like I believe that medicine is evil at the same time. I'm going to share with you guys a little story about, when I first started in Bangalore. This is just kind of to illustrate how negative the medical fraternity could be towards chiropractors. It's not easy, but so I started out in Bangalore, and right across the street from my office was an orthopedic physician. And I went over there one day with a card. I had an appointment. I talked to him very normally, and I said, "Hey, look, I'm a chiropractor. I work right across the street. It would be great if we can kind of collaborate on some cases." And I handed him a card, and he looked at the card and his whole face changes. He slams the card down in disgust on the desk, and he goes, "In 20 years of my career, I've never walked into anybody's office with a card asking for patients." And I was like, "Yo, man, I'm not asking for patients. I'm just, I'm here to introduce myself. I'm networking. We're in the same space. You're an orthopedician and I'm a chiropractor. I think we could work together really well. There's lots of patients who I think I can help." And he just like, "Get the hell out of my office. I don't want to talk to you." And that type of confrontation is common with chiropractors and the medical fraternity. A lot of them, they don't want to know. They don't want to care. They don't want to update. They don't want to be convinced that chiropractic care can be beneficial. Another example I had was I walked into several different doctors. This is earlier in my career with a folder of summarized chiropractic research about how chiropractic could be beneficial to a variety of different types of patients. There were summaries on one side, and there were the full scientific study on the other side, and they were nicely stapled and organized and in a folder. And I walked in and I handed them to the doctor, and the doctor's like, "Thanks." And, following up was not great. They were just like, "Yeah, I didn't read it." It wasn't important to them. They didn't want to have the time to just read a little bit of research about what chiropractic could do. And this is commonplace. This is how chiropractic is regarded amongst the medical fraternity in general. There are a lot of new doctors out there, a lot of modern medical practitioners who are like, "Yeah, you know what? Medicine isn't the only option. There are holistic options here. Chiropractic can play a role in what we do." Now, I'm not saying that chiropractic is all you need. You need to do your diligence. You need to do your exercise. You need to make sure your nutrition is up to speed. You need to stay hydrated. You're going to have to take care of your mental game. All of these things are required in order for you to have good health. Chiropractic is just a really great component of it. So when it comes to adverse effects of chiropractic care, we also need to make sure that all these other elements are being taken care of. If I adjust you today, tomorrow you have soreness, did you happen to neglect to let me know that you also started a new yoga routine, or that you went on a 3-hour bike ride with your friends? These are kind of things that I look into. When I tell you to get out of your chair every half an hour for a minute, and I tell you to do a handful of stretches, it looks like work. It's not an easy to swallow pill that'll make your pain go away. It looks like work, but I still want you to do it because it'll help you minimize adverse reactions and can actually help you get forward on your issue. Our recommendations are simple. Our recommendations are doable, and your job is to incorporate them on a day-to-day basis. What I'm going to do alone is not going to completely fix you. You're going to fix you. Your ability to help incorporate what I'm asking you to do, as well as come to your sessions, as well as understand how your body is changing and how your body is going to get better, that's what's going to minimize your adverse reactions. This has been an awesome episode because I really liked getting into the nitty-gritty of what makes people feel uncomfortable about chiropractic care. I liked talking about the issues that you may face on a regular basis. And I really, really, really wanted to get to the bottom of the safety element. Chiropractic is safe. Chiropractic is effective. Chiropractic can benefit you in ways that you probably aren't thinking about. We're not here to save lives. It's not a life and death situation in most cases, but we're here to save your lifestyle. If you want to go and pick up your kid at the end of a hard day of work, you can do that with chiropractic care. You want to do jujitsu at 45, you can do that with chiropractic care. It is possible for you to see more to your life and add more richness to your life just by doing a few things, and chiropractic is all for that. So if you're interested in adding richness to your lifestyle and you're not terribly concerned about adverse reactions, chiropractic care could be really great for you. And even if you are a little concerned about adverse reactions, discuss it with your chiropractor before you take treatment. It might actually help make you feel better. So this has been another episode of Chiropractically Speaking. Thanks for joining me this week. If this episode resonated with you, like, subscribe, and share and spread the love. I'm Dr. Pratap with Chiropractically Speaking, the podcast. I'm out.